Okay, so Bertrand, we've gotten in touch with him. He's trying to get ready. Do you want, Sergio, do you want to share your screen and check if everything is okay?
Okay, I share it now.
Can you try? Yeah, okay,
Is it okay?
fine. Yes, sure.
I didn't
Okay.
prepare us.
Niveen, do you have any presentation?
No.
Okay, fine. Okay. So, oh yes, but okay, Bertrand, go ahead.
I am a talkative person. There is no need to get distracted with slides.
Yeah. Okay.
I think, Tony, I will allow you to share the opening slide. I think this shouldn't be the first.
Did I say hello, Mr. Moderator? No, I didn't.
Okay.
Hello.
Yeah, we saw you.
Sorry, I
Evening.
came late. This is the problem of coming late.
You didn't, yeah.
Let me share one thing. So we'll just give 2 minutes from 4 p.m. to allow more people to join before we begin.
Do we know where the majority from the registered people coming from?
Josh should be Nigeria.
Nigeria mainly? Good.
Yeah, I think so.
Good. We need another excuse to come back to Nigeria.
That would be great. And we can make it this September.
You don't
for
need
the conference.
you don't need an excuse. You know
Well,
that. You just need to say, I'm coming, and we will roll out the red carpet and we'll be there. So
well,
this
I need
year,
an
next year,
excuse. I need just tell me that we're doing this, and okay. I need to attend
Okay.
this. I'm coming.
okay. So we will, for the 2026, where we will have you on a panel. You
Well,
see the excuses. So you will be on a panel on 2026. As the president of GIS, you always have a table in Anissa. You know that.
I know, but it's the one you're having in
So
September.
we
is
still
gonna
have
be
a September 2 to 4. We can still send a formal letter. We still have at least
But September
8
is the
weeks.
beginning of the semester. It's a bit challenging. October, November would be more feasible.
Yeah, we were trying to
We're starting
avoid,
the
as you knew,
semester in
avoiding.
September. This
Yeah,
was
we were
the
trying to
problem.
avoid that. But that's why we moved it up to the early one, because usually people start, things are not yet there for the first few days. So
Yeah.
it's the first week of September.
It's the first week. We start the semester mid-August. So mid-August until mid-September, this is when we figure out things. It's a bit challenging. But now I have a list to do in Nigeria, lots of things. So I need an excuse, inshallah.
So just let us know if it is by phone call, if it is by email, if it's by formal letter, whatever way we'll give the excuse. We are ready with the excuse. Just let us know.
Well, once I apply for my sabbatical, I think I will be free to travel all around again. I need to wait for
Where
my sabbatical.
are you on your sabbatical? Where are you spending time?
Well, I'm applying for next year to get the sabbatical. Hopefully, if I get it, I'm planning to do it in Liverpool University.
Okay.
But
All right,
still,
so
I'm
that will be
waiting for the university approval.
to come on now. Okay. That's good.
Yeah. But I will be more flexible in traveling, going around, because I will be doing my own research and no teaching at all during the semester.
Yeah, that'll be good. Okay. We will plan it, and then just let us know, and
Inshallah.
we
And
can give
I'm
you a
also
1 year.
pushing Sergio to give me an excuse to go to Chile.
You see?
Any excuse you need.
You see?
Well, during my sabbatical, I'm coming, Sergio, to Chile.
You will be very welcome here.
Thank you very much.
Okay, I think this is a good place to start from.
Okay.
So good morning, good afternoon, good evening, wherever you're joining us from. You're welcome to the 2026 NISA Research Week. Its field is packed with a lot of information, and we're starting today with a great company, a great panel of people, experts in implementation science research, who will be joining us today. This webinar is coming to you courtesy of the Nigeria Implementation Science Alliance. And my name is Professor Tonia Onyeka. I am the Associate Director of Ivan Research Institute Nigeria, who's collaborating with NISA to bring this webinar to you this week long. And so I have the pleasure of inviting the moderator of this session. And before I invite him, I will just briefly say a few words about our moderator. So let me share my screen and let's get to know him better. So our moderator for day one is no other person than Dr. Brian Bertrand Odume, a physician and public health leader and implementation scientist. He happens to be the executive director of KNCV Nigeria, with over 20 years of experience in health system strengthening, tuberculosis and HIV control and infectious disease programs. He has led many innovative data-driven interventions and research that bridge evidence and policy and practice across Nigeria and beyond. And so without further ado, I'm going to welcome Dr. Bertrand Odume, and welcome, sir, and take over the moderation from here. Thank you.
Okay, thank you, Tonia. I think it would be nice to, if you can see, can you see the screen? Hello, can you confirm?
It's loading. Yes, we can see it.
Yeah, it just,
I think. So it goes to the first, yes, yeah.
I would just, I'm sure we can.
So you need to exit and go to your first slide.
Yeah, I needed to come on the what's most important, the research week for 2026. Yeah. Good day, everyone. It's nice to have everyone here, especially our eminent speakers for the day's event. Before I begin, I would like to warmly welcome all participants to the NISA Research Week 2026. And we must thank the NISA BOT, Professor Esther, and team for making this possible. They have actually been very consistent since the maiden edition in 2022. As we all know, that NISA was established with a simple but powerful vision to bridge the gap between evidence and practice. Too often, we know what works. We all have been in the field within the public health space, but the challenges always lie in how to make it work consistently, effectively, and most importantly, at scale in the real world setting. And this is the essence of implementation science. Over the week, from 1st to 5th, we will celebrate achievements. We will share lessons, foster collaboration, and explore innovative approaches that can transform evidence to impact. As we all commence this year Research Week, I will invite you all to engage openly, be open to share your experience, ask very insightful questions, learn from one another. Challenge long-held assumptions. So share your experience. We all are coming from varied background across most disease programs and even health system, and explore new ideas that can help and advance health and development outcome, not only in Nigeria, but globally. And I think with this, I will really go ahead to just take you through the journey of NISA from 2022. I think it has really improved. In 2022, there are about 99 speakers, and the goal focused on equipping researchers and implementation scientists with practical knowledge and strategies for designing impactful research and developing competitive NIH grant application with a focus on implementation outcome and core elements of strong proposal. It had continued in 2023, where NISA hosted 11 key speakers across varied backgrounds in public health and implementation science, and the goal focused on to strengthen participants' capacity to design, conduct, and evaluate rigorous implementation research by building practical skills in the use of core implementation science framework, strategies, and hybrid study design. Moving on to 2024 with 8 speakers, and the goal was to strengthen participant capacity to design, implement, and translate equitable evidence-informed research into real-world practice by building skills in dissemination science, implementation strategies, collaborative research network, ethics, and system thinking approach. And in 2024, a very large team of speakers, about 21 of them, and the goal centered on education, on educate webinar participants on the role of implementation science in sustaining health program in the areas of chronic disease, mental health, cancer, as well as research training and capacity building. Now, and this is where we are with very, very eminent qualified 14 speakers that will be joining us across the globe, some that we already know, some that we will be meeting for the first time. And the theme for this year Research Week, holding from 1st to 5th June, is when evidence does not inform policy and practice, how implementation science can make a difference. I will just restrict myself to what will happen today, being the very first day of the Research Week, and I will bring this down so that I can, let us get to meet the 4 eminent speakers for today before we move on to the session. Can you confirm you can see my screen?
It's coming up, yes.
Yes, okay. Today, why is it not moving? Okay, now we have 3 eminent speakers, distinguished public health leaders across the globe and here in Nigeria. And the first but not the least, I would like to introduce is Niven Abu-Remeli. She's a professor of public health and epidemiology at Qatar University and the president of the Global Implementation Society. Her work advances implementation research, statistical epidemiology, evidence synthesis, and health system strengthening in fragile settings, with expertise in quantitative methods, systematic reviews, and translating research into policy and practice. Niven, you are highly welcome. I'm sure it will be nice to interact with Nigerian audience mainly. And we move to the second speaker today, is Sergio Chacon. He is a psychologist with a master's in social and community psychology. He's a professor in the Department of Psychology at the Catholic University of Temuco and director of ITTC Chile. He also serves as the director of the Global Implementation Society LATAM Hub and a board member. His work focuses on strengthening regional implementation network and advancing context-sensitive science across Latin America. And the last but not the least is Professor Patrick Dakum. He's a distinguished Nigerian public health physician, implementation scientist, and Chief Executive Officer of Institute of Human Virology Nigeria, IHVN. He's an associate professor at the University of Maryland School of Medicine in Baltimore. He has over 42 years of experience in HIV/TB epidemiology and public health. Under his leadership, IHVN has grown significantly, managing large grants and supporting over 350,000 patients on antiretroviral therapy, while advancing responses to HIV, TB, Ebola, COVID-19. Professor Patrick Dakum had authored over 50 publications. Let's welcome our speakers, the 3 of them. will be taking the stage for today. And I think without wasting any much time, we should be moving to what we have for today. Welcome, Niven. And I don't know whether Professor Patrick Dakum has been able to join us. Prof, can you confirm you are here?
No, he hasn't. I think he has a little.
Okay, we'll move on. I'm sure
Yes.
we still have his questions. It would be nice to have Prof to equally share our own experience from the local perspective. Now, today, as we said, this research week will run for 5 days, but I'm privileged and honored to anchor the panel for today. And the theme for today is diagnosing the problem, why evidence fails to travel, understanding the persistent gap between research, policy, and practice. And as I said earlier, across many settings, definitely we all work in public health space with very rich experience implementing a whole lot of projects and equally involved in implementation science. We generate the evidence, we have a whole lot of published work, and even we celebrate the evidence too. But yet far too often, that evidence does not shape policy or translate into routine practice. Now, today's discussion will explore why this gap persists and what it looks like across different contexts and what it will take to close it. And I'm happy we have very rich people with very rich experience, experts across the domains of public health. Today we'll be able to share their own experience from implementation. And I will just start by posing the questions. We will ask some questions and get to hear from the panelists. Definitely, the audience, please have your pen and paper, itemize your questions. We will be able to equally allow you time as to equally ask some of these questions and get the needed answer. I hope we'll be able to have enough time. And for the panelists, please help us. Let's see how best we can manage time. I will start with Professor Niven. Your very first question, I will equally come to Sergio too to add more flair or even some deeper or other different perspectives. You work at the intersection of public health, implementation science, and global leadership. From your perspective, when we say evidence fails to travel, what does that actually look like in real-world health systems?
Well, thank you very much, and it's a pleasure to join the Nigerian colleagues again virtually. I got the privilege to join NISA's conference in collaboration with the GIS and GIC conference 2 years ago. So I'm happy to be with you, and hopefully some of the audience can recognize me. Going back to our to your research question, or to your main question, which is evidence fail to travel. First, let me start with what do we mean by evidence, because the word evidence, sometimes people will think it's mainly what is coming from academic research, but we are a little bit flexible here. We're relying on experience, on stakeholder informative experience and point of view. So we are a little bit flexible, but what we need by evidence is a rigorous information that can inform the policy. This is my way of looking at it. Now, in practice, does evidence fail to travel, or does it travel in a bad way? Let's think about it. Usually, evidence, what we all think about evidence, we think about evidence coming from academia or coming from high resource countries or locations. It does travel badly. Evidence does travel badly because we have general assumption of evidence will work everywhere. What we see on the ground is, for example, guidelines developed, but when we try to implement in certain contexts, we will see that we lack infrastructure, or we lack workforce, or we lack stability. And I would draw most of my examples from where I come from fragile settings and fragile health systems. So we have a problem with the fragility and sustainability of the governance. We also see evidence coming from an effective control settings. When we take it into the real life, we can see that it was misaligned with the political realities, with the funding cycles, with the community trust. And I will give you a very nice example that we are now witnessing, and I think my colleagues here in Nigeria are more familiar with communicable diseases. The issue of vaccine. So we know vaccines are effective. Until now, we have a problem with vaccine implementation. There is a problem with the uptake of the vaccine, the acceptance of the vaccine, even the delivery of vaccine. So we do have evidence, but still it fails to travel because it is designed or produced in a setting that is marginalizing the context or misaligning the political reality, misaligning the priorities. The other point that I would like to add why it travels in a bad way, it's produced in academic format. So academic format, we are very meticulous. We want to produce rigorous product. So the way we build the evidence, we produce the evidence, we need time, we need a specific format, which does not really match the timeline and the format with the policymakers. And this is where the disconnect happens between academia and policymakers, and then the evidence produced will fail to travel. So given these, I would say, these general statements or barriers of what we have in reality, if we take the fragility and the constrained systems, and this is happening in most resource settings. I'm coming from Palestine, from the West Bank. Throughout all my life, the health system is a fragile system. So you can imagine if we are trying to use evidence or guidelines produced in the WHO, whether we will be able to implement it in our system, given the different contextual constraints that we have: movement restriction, fragmented governance, donor dependency. So you can see, in addition to the previous context that I have mentioned earlier, we have also another angle, which is the context-specific context determinants that we need to take into consideration in order to take this evidence. So I would say we do have a bad travel evidence. It does travel, but it travels in a bad way, from my experience. And that's why we are trying to introduce implementation science. So we include and involve policymakers, and we try to bridge the gap in the disconnect between what are the priorities, what are the context specific, and engage the academia and bring the academia into the real life. I would stop here and give the floor to my colleague, but this is my first reaction to this.
Thank
it does
you.
travel, but in a bad way.
Thank you for that very incisive answer and bringing to bear even your own context. We are looking at traveling, and now you need equally to travel against some of this resistance in very fragile setting. I think that's as another angle to the discussion. I will take on Sergio. I'm sure you will want to share your presentation. You have access to share because your question definitely we are looking at your previous work designing and implementing programs for population facing social exclusion. In your experience, why do interventions that are evidence-based on paper sometimes struggle once they reach the communities. I think now they're able to travel down to where the work should happen, but getting it off ground becomes one of the most difficult things. I think you will be able to share your experience. You can share your slide.
Okay, thank you. Hmm. I'm sorry if I have to use this support, this visual support, um, and I maybe I will be insisting in some of the points that my colleague Naveen already said. Um, And just let me say something before answering this question. I would like to say that just a little bit of who I am, because I think that I have to declare my own bias before I start saying what I have to say. Okay? Um, I think it matters for everything I'm going to say. I'm speaking from Temuco in the south of Chile, in the Wallmapu, the territory of the Mapuche people. I want to acknowledge that because my whole argument today is about whose knowledge counts. That's one of the things that I think that makes harder this journey of the evidence. The Mapuche people have knowledge that has never been treated as evidence, but it is. And that's the point on regarding that question. Um, if, as a matter of fact, as an example, Mapuche people has a concept that in the language called Mapuzungun, you call it Kume Mugen. And it's the same concept as we call today One Health. It's the living well, means living well. So why I say that? Because some of the evidence, some of the frameworks and theories and points of view that we use here in South America are brought from the North, and there is a lot of evidence and knowledge here that have to be counted as one. So, and this is not just an ethical issue, this is a methodological one. Okay, I'm a psychologist. I've been working for 20 years with people who have been excluded from the system that are supposed to help them. People living in poverty, people living with mental health conditions, people with substance use disorders, women in prison. And I know the gaps. I've lived the gaps between evidence and practice from the inside. I've been working in NGOs for a lot of years and in government too, and so I know both sides. And of course, no perspective is neutral, including mine. I just want to be honest about that. I have to be honest too that I'm using some notes I take. My English is not my first language. Spanish is. So please, I hope you understand this so I can address these questions and this um, uh, meeting with more clarity. Okay. Regarding these questions, I will be addressing this, the first one now, and I will mix one model that Kanya and colleagues developed that states that there is 6 conditions of the systems that we have to address when we want to answer questions like this. And I will mix it with type 3 error, they call type 3 error, that means the mistake of evaluating a program that has never been properly implemented, and then say the evidence doesn't work. Okay? Keep those ideas in mind. And I won't stop here. I think we already, all that the people that we are here know what we are talking about when we are talking about the gaps that we are addressing. There's different kind of gaps, so I will skip this to explain. Sorry that I take more time to set this, but before I answer the question, um, Kanye and colleagues say that real change requires working on these 6 conditions. Okay, the first 3 policies, practices, and resources are visible. Most programs focus here, and that is part of the problem. The last 3 relationships, power dynamics, and mental models are where the real blockages are. But they are much harder to see and much harder to change. And here's the thing, most evidence-based programs try to change the visible conditions, but they are implemented in systems where the deeper conditions, who decides what counts as knowledge, whose voice matters, have not changed at all. That is not a communication problem, that is a structural. And we have evidence of this from our own region. My friend and colleague, Felipe Agudelo Hernandez, and his colleagues published a paper from Colombia showing exactly how frameworks like FEAR and REAIM, when applied without adaptation in Latin America, reproduce colonial dynamics and overlook local reality. They are not saying these tools are useless. They argue that when frameworks are transferred without questioning their assumptions, they can unintentionally reproduce colonial dynamics. If you want to be more straight, some call it epistemic violence. So that is condition 6. Mental models operate in real time, not as theory, as a documented practice. So, and when we talk about this type 3 error, it means evaluating a program that was never properly implemented. Okay, and then concluding that the evidence doesn't work. We blame the intervention, but the real problem is the system that implemented it badly. In Latin America, this happens in 3 ways, and I guess other places too. First, programs get closed before they even had a real chance, because results take time, and political cycles don't wait. Naveen already said that. Second, funding runs out, not because the program failed, but because the money ended. And third, programs without evidence keep running because they are politically popular. Why programs with evidence get canceled when a new government comes in? We are living that in Chile now. The decision and the effectiveness are 2 very different things. We keep confusing them, and communities pay the price. Imagine a community intervention evaluated after 6 months, even though implementation problems delayed delivery for 4 of those months. Okay? And I will stop here just to explain this diagram. I've been working to try to respond these questions. And this diagram is a mix of the 6 condition models and the type 3 error, and it integrates the 3 gaps that we already know. I invite you to look at the top 3 rows first: policies, practices, and resources. This is where most of our work concentrates, and the problems here are real. Research agendas controlled by external funding, decision makers with no time and no synthesis units to read evidence, programs designed for urban context applied in rural communities. These are serious barriers for the evidence to travel. And they're visible. we can name them, we can, in principle, fix them. Now look at the bottom three rows: relationships, powers, power dynamics, and mental models. This is where it gets harder. Let's take relationships, condition 4. In Latin America, researchers from the South are systematically excluded from the global networks that define research agenda. Not because the work is not good, because the networks were not big for them. And when there is no relationship between the researcher and the decision maker, evidence does not travel. Not because the evidence is weak, but because there is no trust to carry. And when evaluators and implementers have no relationship with each other, we get type 3 error almost automatically. Okay. When we look at the bottom row at mental models, this is condition 6, and it is the hardest and most important of all. The mental models that the node produces knowledge and the self has problems. The mental model that says community experience is context, not data. The mental model that says if a program doesn't produce results quickly, it's probably wasn't a good program, rather than asking whether it was properly implemented in the first place. That last one is exactly how type 3 error gets reproduced over and over without anyone noticing. So what does the matrix tell us? It tells us that closing the evidence to practice gap requires working at all 6 levels, not just the visible ones. And it tells us that the most powerful interventions are the ones that change relationships, challenge who holds power, and question the assumptions we carry about what knowledge is and where it comes from. That is not easy, but it's honest. And I think it is where implementation science has the most to offer, if it's willing to ask those questions. That would be sorry that I took more time.
Okay, thank you, Sergio. I think this is really in depth. It had actually brought a very, very good view to what we've been looking at, and it is very key in systems thinking for the evidence to translate into actual practice. As Niven actually pointed, there are a whole lot of constraints, but you've been able to put everything in a very good perspective. We'll be building on this and go back to Professor Niven. Good thing, and in your very first questions, you were able to address some of what Sergio presented here, some of those major constraints within the system, both the political, the fragile nature of the environment where you implement, and it may be on one extreme compared to what we see in Nigeria. There are still pockets of areas in Nigeria where that can be comparable to what goes on in the Gaza, West Bank, where there are insurgency, war-torn zone. But we will be able to learn more from you, because I'm sure, being a public health leader, there have been some projects, despite all those odds, that you've been able to lead within such settings. And the team from Nigeria here will be able to see one or two things they can take from you, maybe practical examples, how you were able to address some of these systemic issues listed here in Sergio's presentation. And please, if you have questions, just drop in the chat box. We'll be able to read to the speakers to be able to respond. Tony, I will equally check whether Professor Dakum has been able to join us. Over to you, Niven.
I think that's one thing to correct, Nevin, that they should use not the chat box, but the Q&A question, right? Professor Nyeka, is that correct?
Okay.
Yes, the Q&A.
It will be difficult to find things on the chat box. It moves a lot. So, but put it on the Q&A. We'll follow it according to the Q&A. Thank you.
Okay, that's great. Okay, Sergio, you can pull down. Let's hear from Niven.
Okay, so Let me, first let me thank Sergio for this very, very detailed analysis for the problem. I didn't give it a very deep thinking, and especially for the first question, because I think the first question was whether evidence can travel, and my answer was a little bit pessimistic, saying yes, it does travel, but in a bad way. But looking at why it doesn't travel in a bad way, or how people from different low income countries, how we can benefit from our experience. So let me just say, we as a researcher coming from low income country, why our evidence is not taken or considered by the policymakers or in our routine practice? Or is it taken, but it's taken selectively? So from my experience, I will give you, let me start with an example. In Palestine, we don't have a problem of HIV. We don't have this infection. It is there, and it is there for a very limited number. So the statistics coming from the Ministry of Health used to say that we have 85 individuals with HIV AIDS. And usually every year they report number. So we have this information, we know about it. We don't know if there is anything hidden, but these are the official numbers. We have this donor who come every year saying that we need to implement a program on HIV virus. And the evidence produced from my university and from different universities saying that we don't have a problem in HIV transmission within the country. What we need is increase awareness about this virus to prevent having an endemic or to prevent having infection spread. So we've been talking with this donor. I'm not going to mention the donor. They have a specific HIV clinic implemented within the maternal child health services for several years, and nothing was there. It's because we have the evidence, but we have the money with different priority, and the international evidence saying that if HIV is going to spread, eventually it's going to spread if we have all these risk factors. This is one story just showing the mismatch between what the evidence is saying coming from our context and what determine what is implemented there. So this is our frustration comes from here. So we're doing all this research, but nobody is listening to us. On the other hand, we produce some research related to climate change, which it draw attention globally to our work, to our evidence, which then was picked up by our Ministry of Health because it came through international organization. So from our context, what I want to say that we have a problem with the disconnect again between academia and the policymakers and policy priority. But just to put it in a more constructive way, we have misalignment of incentives. So the research that we do, either because the researcher got this project, so we have this project, we're interested in this, or the researcher actually can assess the need in the community, but the research is done within the academia context, it's beyond the government system, so it cannot be taken by there. Or the research was done by a donor. So we have this calling for this research, and we applied for it, and we got this data. So we have this misaligned incentives. But also what we have, I need to highlight this issue, which I think people in Nigeria and all resource countries face, is the power of asymmetry in knowledge production. So the type of research produced locally, even if it was very strong, the global hierarchy determined what counts as credible evidence. So local data is often undervalued compared to international recommendations. So this is another dilemma that we have to deal with in order to give a value for our research. So we invest heavily in generating evidence, but far less in the implementation. So we produce the evidence, but we don't have implementation platforms because of the disconnect. We don't have feedback loop. So we provide the evidence, but we don't know what happens after the whole thing. So without this, the evidence sits as a report rather than shaping what the routine care and practice. Also the context. So context is very important. If we have this political instability and funding interruption and emergency, we have also change in priorities. So my country didn't look at climate change as a priority. We were more focused on immunization, ensuring that immunization programs are functioning well before we start thinking of the impact of climate change on health. So this priority and the emergency, what's happening in Gaza the priority in Gaza is completely different from the priority in the West Bank, which is completely different from priority in other normal setting countries. So stability, the evidence uptake required stability to ensure sustainability, to ensure proper implementation and sustainability. And looking at the experience, how we deal with this problem, I don't know how we deal with this problem because we have this fragmented ecosystem and weak institutionalization. Just reflecting on a scoping review that I've read earlier, most of what I mentioned was listed in this scoping review, saying about the poor understanding of the local context, the weak stakeholder engagement, the low political prioritization, and et cetera, et cetera, et cetera. So this reinforced our framing, the barriers that we are dealing with. So we're talking about structural, which is the institutional, funding, etc. Political, and I want the audience just to reflect on their experience, whether the same barriers are I'm describing, they apply in Nigeria. Political, of course, political is not like an occupier, etc. You have the internal conflict, we have the different types of political, which affects priorities, incentives, and etc. And going back to the relational, we have the lack of co-production. As long as we are working solo as academia, trying to produce the perfect, ideal evidence, or as policymakers who want the quick, timely evidence to make their decision. So all these we can reflect on. I would just highlight the similarities between Nigeria, I will assume this, Nigeria and Palestine. I think the first one, if we want to address this, will be we need to have an embedded research inside the decision-making process or structure. So we need to invest more in our relation with policymakers, have the embedded research part of the decision-making structure. Now, how we can do this, we need to have this close relationship. And in Palestine, we managed to do this in certain topics and in a different timing. So when the situation is ideal, we managed to do this. I remember the implementation of the PIN approach for addressing non-communicable diseases. It was based on evidence. It was based on the increasing level of diabetes in the country. And the country needed to do something. So with this evidence, Ministry of Health consulted with the WHO, and based on this, they started implementing the PIN approach. We managed to do this. Now the implementation is not complete, but at least the decision was based on evidence. In Nigeria, I think this can happen, but we need to have this close relationship by embedding the research and the decision-making structure. We need to build trust before we scale. So whenever we can try things, but let's see whether this program is successful and we can ensure institutional continuity. So it's not just a one-step program that will stop. So we implement at the first stage, test, build trust, and then build on the continue on this. It's short-term implementation, short-term programs are not actually very helpful. Adaptation, I would say adaptation is very important. Going back to the example of HIV program that was implemented, and I think it was implemented for 6 or 7 years, until the Ministry of Health realized that there is something wrong. We are spending money, we have people there doing nothing. So let's start doing the awareness, which we were advocating for a long time. So when we started the awareness, talking about HIV in a context that don't have an HIV, and also a conservative, I would say a sort of conservative culture, wasn't an easy thing. So adaptation was an essential step to ensure the proper implementation of the awareness campaign, not the actual HIV program. Now, we don't have proper documentation for this. So it was done, but we don't have proper documentation because the Ministry of Health has implemented the program. We were part of the adaptation process, but it wasn't documented. We couldn't share this experience. So again, each step we have, until we get this proper partnership, you wouldn't be able to provide the evidence even for other countries to learn from it. And finally, I would say working within fragmentation rather than waiting to fix it. Given our context, still we have a very weak context, a very weak system. But working in fragmentation, we managed to build these different puzzle pieces. We managed to build these different fragmented pieces and put them together to get something functioning given the context that we have. With small evidence, I wouldn't say evidence, small assessment, I can say evidence. With small assessment evidence, we managed to build different fragmented pieces to improve the overall situation. But we need to we started with identifying the entry points, so how we can start, and then how we can incrementally increase step by step the different system and align across whenever possible. And the final advice, and I would say step, is to protect the local knowledge. And this is the strongest lesson that we have learned. We have our local practitioners who are the best informant and the one who have the evidence, because routine data is a very strong source of evidence. People experience and different stakeholders are a very good source of evidence. So protecting these local knowledge and adapting them, providing them, this will, as a package, this will help in ensure that we have an evidence-based programs.
Yeah.
I stop here.
Yeah, thank you, Nevin. I think the points are actually very, very clear. They are very, very keywords that will resonate well with any one of us that's involved in implementing programs in similar settings here in Nigeria. You've really stressed more on building trust. Very, very key. We've had issues with immunization, polio, and that will actually be a very good lesson to take, adaptation. And one point you made here, I think anybody will take home, is protecting the local knowledge. You know, it shouldn't just be assimilation, what comes out from there. I'm sure we are generating a lot. There are things that are locally driven, some local solutions that are giving us the results that we need. We need equally to protect it, and implementation science can equally come up in showcasing this evidence. And to talk really more on political, very, very important, building that political trust. And another point you made is integration. I think that's a buzzword here. And when the resources are very limited, integration will go a long way in using very few resources to achieve more. Thanks for that very great insight. I will move over to Sergio. I think this way implementation science will come on. We've enumerated most of the problems. Sergio, it would be nice if you can help us talk more on how implementation science can help us better account for some of this context and culture, and even lived experience, so that evidence becomes usable and not just publishable. It will travel and it will be able to make the needed impact. You can equally build from your own experience, I'm sure, coming from your background in from social context. Over to you.
Thank you. I'm not sure if I can add something after Naveen's, but I will make my best. Uh, I want to build on one idea that Naveen's said regarding trust. Um, I've been, as I already said, in both sides of this uh, world in implementing programs at NGOs and in government. And there is one idea that I experienced in the terrain in the field is that it's not neutral who is promoting to implement what. I mean, power dynamics. I believe that being in the government, trying to implement a program that is a alternative to address some social program from a particular political color government. And for communities, that is not neutral. The messenger is important on behalf of whom I'm trying to implement something in the field. It really matters. And why I say that? Because trust is the key. Building trust is the key in that scenario. Okay? When you found communities, program teams that don't trust who you are because of who sent you to talk with them, there's no other way than building that trust with participation. You have to convene, you have to promote participation to build trust. It often doesn't work. In my experience, this way of turning evidence into a policy that can be applied via a program in a specific context, if it's just an order, do it this. It doesn't work. Maybe at the first time, teams can try to do that. Communities can be little willing to do what you say, but you have to convince, you have to build the sense and the purpose of what you are trying to implement. If you can do that, there is a high chance that a program can be or the intervention can be implemented. And I would add that there is a previous barrier when you are talking about governments, that local government teams that have to promote the implementation of evidence in the form of programs have to be convened first. You have to build trust with your local teams, and those teams have to build trust with the communities. That, in my experience, have been very game changer.
Okay, thank you, Sergio. I think, Tony, it will help us with the questions, but on a very summary note, I will go back to Prof. Nevin. I'm sure you are from the academia, and most of us here are from the implementation partners space. Just one thing you think can be prioritized, the implementing partners working with the ministries and academia. just for us to improve uptake of evidence in our day-to-day project implementation? What one thing do you think can be prioritized, building from your own experience?
I would say, well, I have to declare that I'm coming from academia and I am epidemiologist. So I'm the person who used to believe in clinical trials. And I want to mention this, I keep mentioning this occasion. The way I was introduced to implementation science was when we were in the WHO working on guidelines. And we were having this discussion about what works, what doesn't work. And I was putting my foot down and saying, this is a very effective intervention. We have very strong clinical trials and we have systematic reviews that support this. And the question that came, so do you think this works in real life? And I was like, of course, we have the evidence. We have clinical trials and systematic review providing this evidence. And then when I reflected on that question, I was like, yeah, I know this because we were controlled everything. And so this is how I start thinking of what happens actually in real life. And this is how I joined implementation research. So just to give you some background about this. So if I want to select one thing, I will select the institutionalization of co-production of evidence and policy. And I would do this, I would select this for the reason I mentioned just now. If we work together, we will be able to create a common language between the different people and common language that we can all understand. So when I was standing and talking about clinical trial, I was using my own language and I couldn't communicate what I want to say with the practitioner who was saying, do you know whether this will work in real life or not? So if we manage to have this co-production of evidence, so the three stakeholders are together sitting, having their common language, then this is the first step. So if we speak the same language, then we will be able to communicate. Once we communicate, then we will bridge the gap and we will be able to talk. Now, again, when I say co-production, I want a formal, funded, accountable mechanism. It's not just, hello, we're going to work together, and I will have the name of the Minister of Health on my paper. It's not this way of co-production. We need to sit together, prioritize, see how we can work together to provide this evidence. So we need to have this platform where the ministers, or not really the ministers, they're important people, but the mid-level people who actually are under pressure to take decision or provide evidence for ministers or for policymakers to make a decision, with researchers and implementers, the people who are sitting actually in the front line facing the problem, to define priority together. And this required policy relevant research. This is how we can put the different things together. Funding. Once the three of us agree on what we need to do, we will be stronger in advocating or asking for the required funding, whether the government will allocate certain fund to fund certain research, or we can as a group to say, in this country, our priority is vaccine. And this is what we want to do. We want to provide evidence to improve vaccine uptake, to understand why people are not accepting this vaccine, what context-specific things that we need to take into consideration to ensure that the vaccine is there, what infrastructure we need to ensure that we have at least the cold chain is there so we can deliver the vaccine in term even infrastructure. So if we are going to work together, I think this is my priority.
Okay, thank you. I think this will resonate well with anyone, especially when you're implementing programs in the third world countries. That's most of us are often dependent on donor funds to get things happen. Agreeing on the funding, collaborative way, both the government, the implementing partner, and even academia. When there's that collaboration, will actually be very key, so that you don't implement to fail. And one key thing to take away, you had mentioned earlier, I often frown at some pilot projects that are not taken to scale. I think in generating those local evidence, your eye should always be on the bigger picture when you will be able to make the needed impact. Before we go over, let me take the last shot with Sergio. I'm happy over 120 participants, and it may interest you to know that there are a whole lot of early career researchers here. Most of them will not want to implement to fail. I think maybe coming from your own experience, what guidance, what do you think that would be key in designing projects? Just from the outset, it's usually nice you plan not to fail. Maybe from your own experience and projects you've had, even from literature, what advice do you give them to ensure that they implement to sustain and they're equally building sustainability in most of some of these project implementation? Over to you, Sergio.
Thank you. I will say that no matter where are you working on, with whom are you working on, if you are at the academia, the government, an NGO, you should always keep in mind that implementation happens in relationships. It's people. The important evidence is a tool. Yes, programs are tools, but implementation happens with people. That idea is key to everything, I think, in this matter. And I would like to take what Naveen said already, and I think that working together, really working together, defining what evidence matters or what evidence have to be find or research is important. And it's important to define with communities, with people that are key stakeholders for projects to social change, to define together what is needed, what is the real need that need to be addressed with what evidence, okay? And let me use example that is not at all academic, but is something that my father always said to me. Okay, you may know how to scratch a back. You may be expert how to scratch a back, but that is useless if you don't know where to scratch. And to know where to scratch, you have to work with the people who owns the back. Yes? So, sorry for that example that is not academic at all, but I just want to express this clearly. That is the way we should work with communities, with people, with teams. See, being aware that they own the back. We just know how to scratch.
Great. I think that's very, very key takeaway for our early career researchers here. For want of time, we want everybody to be involved. I'm sure we've posted some questions. I may call Professor Eche to lead that segment. You can take us through some of the questions that we have. Let's get the participants to be part of this discussion. Over to you,
Okay.
Prof.
Yeah. Okay. Thank you. There's a question in the Q&A for Professor Niveen, and it's from Dr. Martin Edun. He's saying, thank you very much for sharing your expertise and views. In my experience, I find that a major challenge in translating research into practice and policy is the goodwill of the government. What do you think is the best way to overcome this challenge?
Okay, the goodwill of the government. How did you judge on the goodwill? Okay, let me say, first, I don't rely on what is the government will or intention. As long as I have a good relationship and trust between myself and the policymakers, and they're involved in the different process, the different stages of the evidence-based production. I think this is when I overcome the challenge of whatever the government think, or whatever their goodwill is, or whatever their intention is. As long as they're involved from the beginning, inception of the research that I'm working on, I don't have a problem. And maybe they wouldn't take the results of the research, but they wouldn't be against it. So if I can say, having the policymakers alongside, on my side from the beginning, and this is my experience, will reduce lots of challenges, regardless of what their intention is. Now, I want to mention things that I didn't actually mention it here. Some decisions are made in several low-income countries are made based on political reasons, not based on evidence or anything. So whatever the government intention, if there is a decision made to go in that direction, it is there. Now, the evidence will help people consider whether what they're planning to do is useful or not. So I'm not sure if I managed to understand your question with the government goodwill, because we never understand what the government or the policymakers' intentions are. But I think if you want your evidence to be utilized, you need to get the policymakers involved from the first step. At least they are aware of this evidence being generated. It's not marginalized, it is there. It's up to them whether they're going to use it. Does it fit their priority, or whatever their plan they have? Hopefully I answered the question. I'm trying to be diplomatic in answering this question.
Yeah.
Yes, I think so. So there are more questions pouring into the Q&A. This is generally for the both of you. But this is from Xavier, and he's saying, which implementation science tools do you consider most relevant and practical for guiding young researchers in LMIC to design interventions that are scalable, sustainable, and effectively integrated within existing health and development systems? So Sergio, could you take a jab at that?
Yes. That question, it seems simple, but it's not. I mean, depends on what. But in general terms, I would say that in my experience, having a solid framework to address a research challenge or implementation challenge is key. I use a lot the active implementation framework developed by Fixen and his colleagues. And this framework has a lot of tools to address context and evaluate what are the barriers and facilitators, tools to keep in mind what the implementation drivers are
Yeah.
that you have to address. It has a tool that helps you to, it's called the Hexagon tool that allows you to navigate through these different conditions of the context, and after that develop strategies to address it. And you can mix and use models and frameworks and tools complementary. I use this, and also I use COM-B to try to answer the question why people don't do what they're supposed to do,
Just to do.
and look at the capabilities, the opportunity and motivation to do things. And uh, there is no just one right question. See, you have to find the frameworks and the tools that are more useful and operable for your challenge.
Yeah, okay. Someone's asking, please, can you name the tools again? Those tools you mentioned, could you just list them?
I mentioned the active implementation framework from Fixen and collaborators. I mentioned the Hexagon tool that is part of this framework. It's in Fixen and colleagues' book called Practice and Science of Implementation. I mentioned the COM-B, COM/B model, and I don't remember what else did I mention.
Those three. Yes, thank you.
Yeah.
Okay. So, just like Bertrand mentioned initially, there are a lot of early career researchers on this webinar today, a lot of implementation science enthusiasts. And one of them is saying, big thank you to the speakers. As an early career researcher with minimal or no contact with implementing partners or government decision makers, so how feasible is it for me to conduct a full-scale implementation research, especially with no funding? Can I really thrive as an implementation scientist or researcher when I have limited control over the proven intervention that works? So 2 questions here. The first is, how feasible is it for him or her to conduct a full-scale implementation research without funding and with minimal or no contact with the implementing partners or government decision makers? Okay. Naveen? Yeah.
Yes, but I just want to mention one comment on the previous question. For young researchers, my advice is to be open to all frameworks, be exposed to the different frameworks, and then you decide on what framework will fit your question. This is my first advice. And the second one is, don't spend lots of time on getting the perfect intervention in isolation. What we need to do is to make sure that use implementation tools because they are useful in real life and they will help researchers engage with reality. So don't go into perfection and be trapped with the academic mentality. Now, going back to how we can conduct implementation research, full-scale implementation research. Actually, it is feasible to conduct a full-scale implementation research because if you think about it, you're looking at the process, and if you want to go beyond, you're looking at adaptation, sustainability, and scalability. And within that process, if you are in the context, you can do this. It's not as complicated as we think. So it's not resource intensive. It depends again on what your research question is. But you cannot do research without involving implementers.
Sorry, Naveen, I want to point you to what exactly is there, saying with minimal or no contact with implementing partners or government decision makers.
Exactly.
Is it possible? Can he do anything effective?
And his early career. Yeah. So the first one, is it feasible to conduct implementation research with limited resources? Yes, it is feasible. Now, the second condition is not, because if you're not involving implementer, you are missing an essential part of your research. So if you read about implementation, we're looking at a triangle. We're looking at policymakers, researchers, and implementers, and you are missing two main component of your research. So you need to get engagement. Now, I can give you a hint that you can simplify the thing. So policymakers not necessarily to be the minister or not the deputy minister. It can be the program coordinator at that level. It depends on it depends on what you are talking about and what is your research question. But it can be policymakers is the one who can help you. This is the one who will help you with providing the resources, facilitate your work in the environment. This is the type, if I can simplify it. And the implementer, the person who is actually delivering the service, who is implementing the program. So you can go simplify it. You don't have to go to the higher level. It depends on the level you want to do it. But without these two main components, I don't think you will be able to conduct the implementation research. And that's why I keep advocating for the co-production. So if we have a research unit, implementation research unit within the governmental sector, then this is where I think this will be feasible. And this will help young researchers who can come to this structure, and they can actually help in producing the evidence, because implementers on their own, they don't have the time to run research. So they need the support of the researchers and young researchers. So if this co-production is there, then everybody's life will be feasible. I can see Etch's hand up. So
hand is up here.
Yes, thank you so much. The reason I wanted to add to this discussion at this point is really that this is one of the most important questions I get a lot from people, to say, if I don't have the funding and how do I do research? And you have explained one thing that is important. People think of the policymaker as the Minister for Health. The Minister for Health is not the policymaker in your institution where you work. The person that is depending on that type of information, if you work in a community general hospital, the policymaker is the chief executive of that hospital. That's the policymaker. And if you think about research, not as the way of what strategy, what implementation framework, what of those things. One of the things I learned early, all of us came to implementation science, like Nevi has said, from different aspects and different ways. I came to it as a clinician. I see patients. And the only way I came to it was actually on the query. If you remember, if any of you remember QUERI, if you type it in, it was one of the first things developed by the American Veterans Association. And what they were looking at is those quality enhancement programs. So one of the ways I saw implementation science, or I even saw research for me, was a quality improvement. So it wasn't about frameworks. It wasn't about theories. It wasn't about those things come secondary in my mind. The first thing is that what is the problem you're trying to improve? So if you came into your own organization where you are working, the best research are usually done when it is embedded. So when I talk about implementation science now, I talk about embedded implementation science. What does that mean? That really means that you are doing this work where you are. So if you are in your place and you find out, simple, the first project I was doing was every day we schedule clinics, and we have people miss clinics. And we started to say, how do we actually make people not miss clinics so that we don't waste time of our providers? This was a question relevant to us in our own practice, embedded in our problem. So we said, okay, can we start to call them a day before the clinic day as a reminder, and then do a recall? So these were the two things we began to do. So we started to look at it, and we titled it The Impact of a Recall Reminder Program on Improving Immunization, because that's what we wanted to do. And then when it came out, it was such a very important paper that we are doing. And people were actually looking at it. It was well quoted because it was simple. It was answering a question that we have. We didn't spend any money, so to say, extra to look at funding for it. The second project that we did that was important is that when people come in, I'm an infectious disease doctor, when people come in with fever, we suspect infection, we start them on antibiotics while we're waiting for the blood culture and everything. And then we ask our research question, are we getting it right the first time? And all we did was to take the blood culture we had for the 5 years. We looked at the antibiotic we started before we got that culture and asked ourselves, was it correct? In retrospect, but that was actually one of my first funded projects by the Infectious Disease Society of America, because they thought that question answered a very important thing. So when you think about research, don't think about it as the frameworks, about the theories. Think about it about the issue in your own environment that you can actually resolve. Thank you.
Okay. Thank you so much, Prof. Okay, I see Sergio and Niveen. Okay, let's start with Sergio. Yes, go ahead.
You. I would say this: in Latin America, we are used to doing a lot with very little. So this is a known terrain for us. And I would say that we have to think that research can have different phases, clinical trials, and every phase that you need. And a few decades ago, a Colombian sociologist called Orlando Falsborda developed a methodological approach known as participatory action research, which involves designing and carrying out the research process collaboratively with the community from the beginning. And the very important question, how can we fund this research, can be answered with community too. And to get the funding for doing what you need to do with community resources and other resources that with the community you can spot, is a very good way to address this with little funding.
Thank you. Okay. Niveen, do you want to add to that?
I just want to say, just when Echo was saying embedded, I didn't want to use the word embedded research because this is the term used by the WHO. They're advocating for the embedded implementation research. But just reflecting on this, I was involved with the WHO in several projects in relation to implementation research. So in EMRO, the WHO has a very simple initiative, which was, we want to help people understand how they can conduct research in their own workplace. So it's the idea of embedded research, so to educate the implementers on how they can provide evidence to inform their own programs. And one example was about the baby-friendly hospitals, and it was only a training, two rounds training. So we provided them with a training, and then said, go to your own workplace, look at your program, see which program is facing a problem in implementation, and then come back to us and tell us how you solve this problem. So we didn't provide any funding. And this is for young researchers. The idea was they went it was like 12 countries. They went back, they received the training, they went back. Once they got the tools, and we didn't use any framework, we just provide them with very simple tools, they managed to go back to their reports, assess the proper implementation of programs. And they found, when they looked at the context, they managed to identify the barriers, discuss with their superior, with their heads, higher administration, how we can solve this problem. When they came, and it was only 3 months period between the two trainings, out of the 12 countries, 9 they managed to solve the problem, because I managed to identify what was the problem, and 9 managed to solve the problem. And it was simple training. So it's not even an academic training. It was a 5 days training. They went back, and this is what I say, we need to establish the language and provide the tools, and people will flourish. And I was really happy with that program. So it's just sharing an experience, And giving promises to young researchers, you don't need money. All what you need is some tools, a researcher eye to identify what are the problems and what are the barriers and how you can solve the problem.
Thank you, Naveen, and thank you, Sergio. There's also another question related to funding, but I think we'll pass this and we'll ask Xavier Nkanu to be here on Thursday, because Thursday, day 4, will answer this question. So let's skip to the next question from Dr. Obianuju Anyebosi. She says, thank you for the wonderful and impactful discussions. For us in LMICs, are there emerging approaches or innovations that can help us improve or close the research policy practice gap? So Naveen, you want to start? Is there anything that is emerging, an emerging approach or an emerging innovation in the LMICs?
Well,
anything you can think of?
Now I will wear the hat of the president of GIS, if you allow me to do this. It's not an innovation, but I would say an initiative. The initiative is we are taking as a global implementation society is we're trying to ensure equity in science and evidence and knowledge. So what we are trying to do is we're trying to connect south to south people. This is where we can learn from each other. So it's an I would say initiative, not innovative. But coming together, we will be able to learn from each other experience because we have similar contexts. What Sergio was saying is very much similar to what I'm saying or experiencing. And I'm sure our audience in Nigeria, they can link and relate to what we were saying. So we have similar conditions, similar challenges, similar barriers. And the initiative of the Global Implementation Society is to bring people together so we can sit, discuss, and come with an innovative solution in order to improve implementation science and knowledge uptake here and evidence provision in low-income countries.
Okay. Thank you, Naveen.
Here, and I'm not academic. I'm GIS president. So
we're getting stuff from the two of you, and we're grateful for that. Thank you so much. So there are two questions here I'm going to pose to Professor Eche. Prof, is your camera on? We have two questions for you.
Yes.
Yes, Prof.
Yes. And Eche, you still have your hand up.
Is his hand still up?
Yes.
Go ahead. No, okay. I'm here.
Okay, so we can go on with the questions. So two important questions. And the first question says, how can researchers better work with policymakers and implementers so that the findings, research findings are timely, they are relevant, and they're more likely to inform program decisions?
So this was one of the questions that originally was meant for Patrick Dakum, who is the CEO of IHV and one of the our main. But also, it's a question meant for Bertrand, who is also a CEO of an organization, so that is here.
Yes.
But I'm going to say this from someone who have had an opportunity to interact with policymakers, with funders, and then with people who actually implement these programs. And I can tell you one thing, 2 days ago, it wasn't on Friday, I was meeting with the executive director for our National Primary Healthcare Agency in Nigeria. And one of the things he kept emphasizing, I don't want academic questions. I don't want academic questions. I want things that have an impact. And one of the things that came to my mind, I remember I wrote it on my book, and I'm just going to read it to you how I wrote it when we met. I said, what happens when the research questions are generated by the users of evidence? So I kind of thinking about it. How about if the questions, the research questions that we ask are where we actually have a forum where the CEOs can say, these are the problems we want answers to. I run an organization that is working on TB, improving TB outcome across the country. And one of the challenges we are having is this, and this. How about if the research questions are generated to answer those questions where the users of evidence are the ones who are posing the questions? So I do believe that that is one of the new things that can change the way, the last question was asking what new things can change the way we are able to translate those things. If those questions are responsive, Again, right now, what we are seeing, we're the only ones asking the questions are the funders of the research. So they get the money. They say, what are the things we think is important to you? And they say, these are the questions that are up there. What if they ever change it in the co-creation, in those co-production, where, for example, a development partner says, okay, I want to go to the National Primary Healthcare Agency in Nigeria and say, tell me, what are your top 5 main issues? And then they decided, and I said, okay, if I want to support project in Nigeria, I want you to address these 5 top questions. So when you do that, when that question is now generated by the potential user of the evidence, which is the primary care agency, which is the policymaker, the likelihood of them waiting for those answers to a problem that they generated and asked for help was important there. The first time I got into implementation science was this. The PEPFAR program was not allowed to do research, and they were trying to figure out how to reduce mother-to-child transmission, but they weren't allowed to do research. So they took their funding and went to NIH and said, we want a question, but we don't have 5 years to do this question. So instead of the usual money that we give for 5 years, we want to give this money for 2 years. So within 2 years, we need the evidence. We were not waiting for 5 years. So they doubled the money per year and said, we need evidence of how we can actually do that. My project at the time was to say, the problem I was hearing everybody to say, we have already screened everybody that came to the hospital, but we're not getting, we only still have less than 20% of pregnant women screening. At that time, community-based screening was not a thing. So my project was based in the churches and in the mosque, where people were actually screened in the churches using the baby shower trial, most of you will remember. But that was answering a question that was coming up from the user for evidence. That year, of course, those things were now implemented. People use community-based intervention. Now, I don't think you can do any program in Nigeria without community intervention, because people came to recognize that even if you screen every pregnant woman that comes to the hospital, you will still be less than 40% of pregnant women in Nigeria, who other 60% that don't come there. So one of the things to think about it is that your major questions shouldn't be, there should be, what can I do if I'm working as KNCV, for example, and I'm using that because the CEO is here. And I'm sure there are questions that they want answers to. And I'm working there. And when you are working as KNCV, think of yourself as an embedded implementation scientist. You are the researcher. There is no other person you're looking for, you. So if you say, this is the problem we have, we want to increase pediatric TB detection, and this is our problem that we're having here. You pose that problem, you said, I want to be able to do that. You go to the CEO and say, this is something I want to look inside our own program, how to improve this. I can tell you that if you finish and then you present it, and like we have seen, during the NISA conference, we're going to see people present a lot of this work that they generated without funding. A lot of them were answering questions that they were answering and being able to come to the solution. And when they find out, what you're going to see is, of course, the CEO has a program already. So what he's going to see, oh, this is one of our solutions. He is going to adopt it because this solved the question he has been asking of how we do this. You don't need the Minister for Health. You don't need the Director for the NCDC to be able to adopt that question. You see that thing adopted at your level immediately by your CEO. So I still believe that good research begins with quality improvement ideas. How can I improve this? Not just how can I add the research question. That improvement is implementation science. And I think that's the way I continue to think about implementation science. And I think if you do, you'll find out that adoption from policy today is actually easier than most people think. And you can see your project adopted even more than those bigger institutions and bigger funding research that have been done that, yes, they publish more papers, but you can find out that this. And then when you actually connect yourself with someone, this is where the external researcher comes in. When you think of yourself, I've seen people who ask me, Prof, I'm designing this question, can you help me? And I say, sure. And I look for the ones that interest me because I think it answers practical questions for them. And that is how we select the ones we support. So again, I think that is the way I think of connecting that evidence in a way that you are sure that what you produce is utilized. And actually, most of the time, cost you less money because it's within already what you do. So when you leave today, remember this, that you have a new name. You are now the embedded implementation scientist. Don't look for any other person. You are what you're looking for. Ask yourself, how can I improve the quality of the program that we do? And you already become a researcher from that question.
Yeah,
Thank you.
okay. Thank you, Prof. Since you got KNCV, it will probably be nice to share some practical experience too. I looked at the tripod as Professor Nim actually mentioned. I agree with you. When the implementer is the researcher, even the uptake is very, very fast. And I think what had worked for us at KNCV is that solution-driven mindset. Implementation science must be informed by need. In most of our projects, we identify some gap in programming, we identify some need within the project. And that's what actually drives most of our implementation science based work. But one key thing that Prof mentioned for us that work with government, in most of these cases, I always want to see a pilot project to be taken to scale. It's not just the beauty, you've done it, it ends there as an implementer that have a very narrowed space. But having the government, the policy makers from the conception had actually worked for us. Even in the, you could see them as even the co-PI, and you do it together, you brainstorm, you'll be able to sell the idea. Let them see the need as you see it from your project. I think once you get that early buy-in, you usually see it being reflected. And if you look at most national guidelines for us that had worked in TB, these are just little things, some of very few gaps we've identified in program, working with the government, demonstrating that result even from pilot, and you could see it be reflected in most of their policy guidelines. I think the key word there is collaboration and having them to key into your vision so that you will be able to get the results, have the needed impact. I think, Tony, you can say continue with more questions. We still, how many minutes do we have more?
Yeah, Prof, yes, sir. Prof still has one question unanswered. So, Professor, you have one question unanswered. Okay, so let me fire on. Looking ahead, what gives you optimism that the gap between research and practice can narrow in Nigeria and across Africa?
No, first of all, is this idea of country ownership. And I think this question you asked me, you give me freedom to take it where I want, right? And I'll take it to one place I want to take it to. And to me, what gives me optimism is actually things like the Nigerian Implementation Science Alliance. 10 years ago, when the Nigerian Implementation Science Alliance was starting, we were asked by the CDC, the US CDC, for them to support our project because they thought it was a good idea that people didn't have to go to the US or to London to present results of what happened in Kano or in Imo State. That first of all, those are not the policymakers in New York. Yes, they're the funding agency, but they're not the policymakers in New York. And that is just my alignment, where you are working to provide results for the funder who is not the policymaker for your country. And so one of the things NISA started at the time was actually to be able to have those forums to present, just like what we're doing today. That's one of the things that came from NISA. Just like what we're going to do at the conference. That's what, and when we started it, they wanted to fund it. We said no, and they were really very surprised. You know, and that's one of the reasons you see whenever you talk about NISA, we talk about NIH, because NIH was our partner. We asked them to help us, but please, we didn't want funding. For the first 3 to 5 years, we're not going to ask for funding. And everybody thought it was crazy not to ask for funding in an idea that people thought was a very good idea. Why am I saying this? That is one thing about sustainment. You know, USAID wanted to support those programs. We said no, because if you do, you'll be CDC program, you'll be USAID program. So we wanted to be able to do it as NISA. And the whole idea was that we have then to make a value proposition to everybody that is going to be involved to be able to do that. And I can show you year after year, year after year. This year we have 426, abstract that were submitted to this meeting. It's amazing. You know, I remember the first time KNCV came to part of NISA, what brought them to NISA wasn't, they didn't, the only thing that we noticed that after the abstract were reviewed, number one, KNCV, number two, KNCV, I was asking them, who is KNCV? It was not because I have never met Bertrand at the time. So the thing that happened was the first place the abstract was like, of the abstract we have, 50 were coming from KNCV, top abstract number one. And if you know how we review the abstract in NISA, you realize that they weren't jeopardized. They were totally, I don't even know, I don't involve in it. Most people who are NISA don't get involved. He doesn't get involved in choosing that, even though he is the host for this year. But if you ask him how many abstracts we're choosing, he does not know,
I don't know.
until those things are done. So again, those are the things that give me hope. So if you ask me why I'm hopeful because countries are beginning to take initiative to recognize that they have to sustain these programs beyond the funding agency. I ask myself, if you want to write for funding, think about a project you would have done if you were Bill Gates' son and you had all the money, right? So think of something that is important to you, not just because the funding is there, but this is a project I really wanted to do, and funding may make it easier for me. So I'm seeing more of that, where people are asking questions, they are interested in the answer, not just on the money. The money is good. The money is important because every good research requires money. But that is not to be driven just by that. Unless your own idea is, let me finish that project and find what else, where is the money? And I chase that again. But you can actually put and say, let your research questions. I think Bertrand, he said something that I wrote down, and I'm very glad. I always have a notebook by my side when I go to conference, and I put it there. He said, implementation science must be driven by needs. So this is my first opening in my next research grant that I'm writing. I'm going to say implementation science must be driven by needs. What is the local need? Whether it is in your organization, is when you address needs. And I'm beginning to see people, the abstract that we see, the 450, the largest in the last 10 years, I'm seeing the questions they're asking is the question that respond to needs, not just the frameworks. Yes, there will be a time you want to be able to organize it and bring in the principles of implementation science, be able to have a framework that used to do that, be able to name the strategies, define the strategies and all of that. But that gives me hope that people are taking understanding that research is to solve problems that exist in their own context. Sorry, you asked me, so I did.
Yeah, Tonya, you still have more questions?
There are no more questions. Go ahead.
Okay, thank you. I think we'll be closing. Maybe I can just take one short.
Okay, there's actually one question in the Q&A, please, from Professor Kwok. Okay. Yes, from Professor Peter Nko. He says, how important is evaluation of the program process, the fidelity in implementation research ecosystem, and how often is such a study funded? So he's asking you, Dr. Bertrand, he says his question is for program implementers. The importance of evaluation of the program process, that's the fidelity in the implementation research ecosystem.
Okay, from a program point of view, I'm sure the academicians too can equally come in, but I think most of, for us in a program implementation, it must actually build it in from the outset. Sincerely speaking, in the design of your projects, even these are some of the things that even the funders will want to look at. I know in most of our projects, yes, you could see some midterm evaluation being built in and end-term evaluation. And I must tell you that a whole lot can actually come out from the findings from such an evaluation. We've addressed the issues of how do you address some of these gaps. But I think the findings coming from some of this evaluation can even pose some research question that you can take up in the other subsequent life of the project. And you're able to answer those questions and we're able to come up with something that can inform policy. Maybe Nivim and Sergio, if you may have one or few things to add, you can actually add it to your closing remark.
Okay, I will start. I just want to summarize what we were saying in the last 2 hours. I would just say that we are heavily involved in investing in producing evidence, but until now we didn't pay lots of attention into designing the system that can absorb and use this evidence. So what we want now from implementation science is to shift the focus not only on from proving what works, because this is the initial idea of implementation, to see what works, to understand how system can actually take it and work in a context. So we want to focus more not only to see whether it works or not, but also how the system can actually absorb what we are producing. Because even if we manage to say that this is how it will work, we need to make sure that the system is absorbing the evidence that we are providing.
Yeah, that's actually very, very key. Sergio, a closing one from you. Professor Eche will still come to you too.
Thank you. Regarding fidelity, I will say that it's key to research on that and consider it as a key variable that we have to be aware of in order to avoid the type 3 error that we mentioned before. And unfortunately, in my experience, it is not very often considered, and it is not very often funded in research funding here in my country from the government and the government agencies dedicated to fund research. Said that, I would add that regarding the involvement with communities and the importance of building relationships. No, building implementation over relationships. We can also use implementation concepts to address that challenge. I mean, acceptability, the concept is that a key concept that we have to keep in mind when we convene people and communities to start a implementation project. That I would say.
Okay, thank you, Sergio. Dr. Eche, can we have a closing one from you?
No, I just want to thank everyone and thank Sergio and Naveen. Thank you so much for opening this week for us. It's usually a week that is full of an excitement for us because it is usually our midpoint to the NISA conference that is coming up September 2nd to 4th. People have the opportunity to meet, and Naveen was there. And Sergio, we hope that it will be time for you to come to Nigeria. And what we are believing in Nigeria is that we really have a need that we have identified as a country and as a region in Africa that we are solving. And when we talk about partners, we are looking for partners who are interested in answering those questions that help us with our needs. So I think when we look at these questions and say, how can we do this? How can we do this? We are looking for solutions that we can actually keep, that we can actually sustain, so that at that time we are hungry for solutions that we do. And if we can find a way to tie these fundings, to tie this implementation, to tie programs into the needs that we have, you will be able to sustain programs, which is one of the things that is important. And I want to encourage everyone to come back tomorrow, because tomorrow we're going to be talking about this. We're going to be talking about the policy system and power. Thinking about navigating politics, incentives, and decision-making in implementation science. You will see that it is not enough. Somebody said, do I have to be a politician to be a scientist? I said, yes. If you want to be a father, you have to be a politician. What does that mean? You have to be able to negotiate with your son when the curfew is by that he can't play video games till it's midnight. And it's the same principle that is involved in everything. Because as a researcher, you still have to sell these ideas, this question, these things you're doing to the policymakers and the implementing partners. So please come back tomorrow, and thank you so much today, Bertrand, for all your work and the things that you do. And thank you everyone that is here. Thank you.
Okay, thank you, Professor Eche. We must thank Sergio for coming on board, and Prof. Niven. We are really very grateful for the insights you provided on this panel. We must equally thank the NISA team, Tonia and team, the admin, for the hosts. And most importantly, I have been looking at the participant list. We had over 100 from the start till this finish line. We must commend them for the interest. I think NISA is for of us, and we are glad not only sharing experience from Nigeria, we were able to garner experience from very acclaimed leaders in public health research and implementation, all the way from Chile, University of Qatar. We say thank you for your time. And for all participants and the NISA team, I think we can now draw the curtain close. It's just 8 minutes more to closure. Sonia, are there anything from you ahead of tomorrow?
So a few announcements. Thank you, everyone. Just a few announcements to share. Just like Professor Eche said, day 2 is tomorrow. So NISA Research Week continues tomorrow. With policy systems at power, evidence meets power, navigating politics, incentives, and decision-making in policy implementation. You don't want to miss this. Also, more importantly, is the reference he made to a very big program coming up in September. And that is the NISA Research Week. I just shared that before. I put in the chat the link to our NISA website, and I think we should all be going there for information about the NISA Research Week, which is from the 2nd to the 4th of September. The theme is From Evidence to Impact, Advancing Implementation Science for Sustainable Development. And I'm proud to say that the host this year for the 11th NISA Annual Conference is none other than Dr. Bertrand Odume, the CEO of KNC International. So he's our host. Everybody, please register. Niveen was there. Niveen was there as the president of GIS. She was at NISA in 2024 in the person, in flesh, because she was co-host with NISA for 2024, and it was a wonderful outing. And Sergio, we're hoping you'll be at NISA in the flesh next year, but at least virtually this year, please. Yes. Yeah. So these are the announcements I want to make. Thank you so much, Dr.
Thank you, everyone, for your time.
Awesome. Yeah. Thank you. Awesome insights from you. And thank you, Professor Sergio, Professor Niveen. And thank you, everyone, for staying right up to this moment. Yeah, see you tomorrow. And take care. Have a great rest of the day. And bye-bye.
Yeah. Thank you very much. Thank you. Bye-bye.
Thank you.
Thank you.